We're here in Toronto today with Dr. Brad Bowens to discuss his new book, Overcoming Barriers to Progress in Psychotherapy, A Clinician's Guide. Hello, Dr. Bowens. How do you know if psychotherapy fails?
It's really a matter of both the therapist and the client deciding whether it's working. I mean, the client has to feel that they're getting something from it, that they're progressing, and the therapist also has to feel that there's some forward momentum as well.
Dr. Bowens, is failure to progress in psychotherapy common?
Actually, it's more common than what people might think. That dropout rates can be up to 35%. And of course, dropout is a form of failure, clearly. And in addition, quite a number of people beyond that just feel they're not progressing, or the therapist doesn't feel they're progressing. So yes, it's actually quite a common problem that really needs to be addressed more than what it is at times.
How important to success is the motivation of the patient?
As with any fairly complex endeavor, motivation is really important. That definitely applies to psychotherapy. And in the chapter to deal with that, I look at it in terms of the benefit-cost ratio, like what are the benefits to the person, what are the costs, and it's important to highlight benefits and address costs. Another is motivation to change. Some people really aren't that motivated to change, and that can arise from different sources, such as, for example, fear of change. And there it's important to look at how in 9 out of 10 times at least, the reality is never as bad as what the person fears that it might be. And then if they see the pluses of it, they are much more motivated.
How relevant are the expectations for psychotherapy?
Expectations like motivation apply right from the start, and they weigh in really heavily. I refer to the expectation reality mismatch. It's relative. If a person's expectations exceed the reality, then they experience loss-related emotions, sadness, disappointment, which demotivates. If a person's reality exceeds expectations, they experience gain-related emotions like happiness, which motivate. So looking at that balance is crucial. And for example, perfectionists tend to set their expectations on the ceiling, so it's very hard for the reality to exceed that. Another key aspect of expectations is linear progress. A lot of people assume with psychotherapy that you'll progress a certain amount per unit effort. And that is often not what occurs in psychotherapy. That sometimes there can be a flat period where there's really no progress, and all of a sudden massive progress. Abuse issues are common where it, never mind just flat, it can be even worse initially for the person as they struggle to deal with the various emotions, and then as they gain a sense of empowerment, they really progress.
The book addresses client, therapist, and interactive impediments. Why did you divide the coverage this way?
The focus is typically on what the client is doing, that it's the client that's creating obstacles or barriers to progress. And while that applies in many cases, and I cover various client barriers to progress, it also relies on the therapist. The therapist weighs in heavily, and also the interaction is very, very important, such as with the therapeutic alliance.
Why do you feel therapeutic alliance is important?
The answer to that is partly subjective, that I found, and many other therapists have found, that it's crucial to the progress of psychotherapy, but also research. Research really strongly demonstrates the importance of the therapeutic alliance. And there's factors on both the client and therapist side. Something that applies to both is attachment patterns and communication. That if both the client and therapist have a history of secure attachment, that really is a good indicator. And also communication, that there has to be an open communication, a dialogue back and forth. That's really crucial. Therapist empathy is another thing that's really important. And the therapist must be focused also on building rapport with the client and making that bond.
How can the skills of the psychotherapist influence the success of the patient's therapy?
Therapist skills are very, very important, and they can be divided generally into non-interpersonal and interpersonal. Interpersonal are very important, and they really do contribute to the success of psychotherapy, and if they're not there, the dropout rate. There's many skills. Critical ones include rapport building that was mentioned previously, appropriate responsiveness, knowing when and how to respond, also setting boundaries. That's a very important issue in therapy with certain clients. In terms of the non-interpersonal, it really deals with things like organization, how to organize your practice, how to organize the assessment and sessions. And also another one that's very important for therapists is self-care. I've seen too many therapists, psychotherapists, social workers as well, others burn out from not looking after their own well-being. And that's really important with balance and setting limits on their practice.
How is this book different than others addressing problems in psychotherapy?
There's a tendency nowadays for psychotherapy to be in very discrete forms, like, for example, cognitive behavioral therapy or mindfulness, this type of thing. And coverage of impediments to psychotherapy progress often aligns with this, being focused on a specific form, like, for example, completing homework assignments in cognitive behavioral therapy. And there's value in this certainly for the particular form of psychotherapy, but the coverage here deals with across therapies. It's all different types of therapies in general. And no matter what type of therapy is transpiring, there's certain problems that are always relevant, such as motivation, expectation, transference, countertransference, the therapeutic alliance. And this book is really an across therapies approach to it. So it's applicable to people who practice more eclectic psychotherapy, combining elements from different ones, and also applicable to those who focus on a particular form.